Fortis Glow. Fortis Glow.
Baldness has become a major concern for people in recent times. Hence, people are switching to hair transplant.
Welcome to Fortis Glow. I am Dr.Vinod, a plastic and cosmetic surgeon practicing at Fortis Glow in Fortis Hospital, Vashi. Hair transplant is the only permanent solution that eliminates the baldness and gives full head. This is a type of cosmetic surgery conducted at Fortis Glow, which has different types of procedures and techniques to regain lost hairs. We take great pride in our high-quality clinical care provided by caring professional staff and trained physicians.
Dr. Vinod is an alumni of the renowned GS Medical College and KEM Hospital, Mumbai. He's trained in body contouring and breast surgery in USA by Constantino Mendita, and hair transplant from France. He has been trained by eminent plastic surgeon of Turkey Nazim Sirks for rhinoplasty. He has ultra-modern setup for hair transplant procedure like safe system for FUE technique. He has invented special technique for close packing known as Mumbai and Panter. What are the main types of hair transplant surgery procedures? Hair transplant surgery can be done by various methods such as follicular unit transplantation, follicular unit strip surgery, follicular unit extraction, direct hair implantation. Though hair transplant surgery is a cosmetic surgery procedure, it is a minimal invasive procedure. Thus, hair transplant surgery is performed only at superficial hairs of scalp. Hair transplant surgery is performed only at 2 to 4 mm skin depth. What do you mean by FUE hair transplant? FUE means follicular unit extraction, performed either manually or with motorized FUE machines. Manual FUE is performed with FUE punches of varying sizes from 0.8 mm and 1 mm in diameter. What are the steps to perform FUE hair transplant? The first step in FUE hair transplant is to trim the hairs at the donor area in order to make the safe donor area for graft harvesting. Once the donor area is marked, local anesthesia solution along with tumescent is injected to numb the area, followed by use of FUE punches to deliver the grafts. How rotary FUE is performed? Rotary FUE is performed by FUE handpiece attached to it. The FUE punch attached to handpiece rotates at a certain RPM. When placed over the trimmed hairs of the donor area, the punches rotates and cuts through the skin to a depth of 3 to 4 mm. This is repeated several times and finally grafts are delivered. The grafts are removed with forceps by gently pulling motion without causing any transaction to the roots. The harvest grafts are subjected for removal of any extra tissues under the magnifier or microscope and finally implanted into the recipient areas. What is the recovery time in FUE hair transplant? The FUE donor area heals in 2 to 3 days and scab starts to peel off between 3rd days to 14th day of FUE hair transplant procedure. What about any side effects with FUE transplant? There is no matter of concerns regarding side effects. Dr. Vinod runs a busy cosmetic surgery clinic at Fortis Glow in Fortis Hospital, Vashi. To schedule appointments for consultations and surgical procedures, please call 9920-366-459 or 3919-9022. Email your queries to drvinodweech@gmail.com or visit www.hairtransplantmumbai.in.